everyone, my name is Melanie Grant, and this is C&M Glass. Today's discussion, we're going to be looking at ICD-10-CM Coding for diagnoses on diseases of the musculoskeletal system and connective tissue, codes M00 through M99. For this lecture, we will be using the ICD-10-CM Code Book, Expert Edition, published by AAPC for the 2019 year. And I will be referencing a textbook from McGraw-Hill Connect for the Let's Code It 2019 edition. So let's look at some of our key points and get started. Our key points, well, we're looking at the musculoskeletal system. We'll be talking a little bit about joint diseases and spinal diseases and how we address these when we're looking at coding, as well as pathological fractures versus acquired conditions, congenital disorders, and soft tissues. You'll notice that there's a couple of key points that have stars on them because they identify areas that you want to pay close attention to when you're coding to make sure that you're coding from the musculoskeletal section as opposed to other areas such as injuries or congenital disorders where you should be in the congenital section, and exactly where in the soft tissue you are versus the skin. So as we go forward, keep in mind that some of these areas may be talking about other parts of your coding systems, and it's very important to pay attention. Okay, so for the ICD-10-CM Coding Chapter 13, we're looking at, in my book on page 767, I turned to this because I can see the very beginning of the musculoskeletal section. And woo, this one is a little bit of a bigger one. So we have quite a few pages here. It ranges from page 767 through 861. And in my book, I have some anatomy information on structure of the human bone, goes into various different areas of the musculoskeletal section. When we turn the page, we go into the skull. We have bones at the lower and upper extremities, joints of the trunk, and this goes on for several pages. So if you couldn't guess it already, one of the big things that's very important in the musculoskeletal section is paying very close attention to anatomy. Identifying exactly what bone or what muscle is being treated is very vital to a coder, and making sure that the doctor has documented that in their note. If they haven't documented it, it falls down to, can we code it without this information? Will it be paid? Is this something the doctor should know? One of the things I always used to tell doctors when I was training them is, you have patient blue, comes in not so happy, getting treated for a fracture of his right arm or left arm as it may appear to you anatomically. We'll say this is the right and left. Okay, we'll just do it that way. So he's getting treated for a fracture of his left arm. Now, if this is a pathological fracture, of course, it goes under the musculoskeletal section. So patient blue is here. He has osteoarthritis and as a result has a fracture of the left arm. But the doctor just says osteoarthritis with pathological fracture of the arm. In that case, we cannot get paid most likely for that visit because the doctor should know what arm it is that they're treating, what part of the arm that they're treating, what part of the bone was being reset or had treatment to it, as well as any of the other conditions. What joint are we looking at? What part of the spine? These are all anatomical locations that the provider should be documenting, and it is a proper documentation control that, depending on your office that you work for, should be addressed. So what does that mean for new coders that are just learning? Well, remember our golden rule. If it's not coded, if it's not documented, it didn't happen. So the way that this golden rule works is, a lot of times if you have a patient who has clear documentation that something was done, we have to determine if the smallest amount of code that applies to this patient can apply to what was done. And the same thing applies for our diagnoses. Can I determine a diagnosis based off of what is documented? And if it doesn't say it further, well, as long as I have a diagnosis, I've coded to the highest specificity. And that that's how I have to apply my code. Now, there are going to be cases where you don't have, and you have an option of something additional that's needed from documentation that isn't there. In that case, it's either not billable or, preferably, a query to the provider needs to be made. So keep those things in mind as you go through your exercises and reviewing when you're learning about new codes. Now, going back to our code book, we have common pathologies, and finally, we get to page 774. So we have a lot of pages here that just give us a lot of really great references on anatomy, locations of bones, numbers of bones, and various other information, including common diseases. So you want to keep your medical terminology in mind when you're looking through this. Page 774 starts the beginning of the chapter. There are notes and exclude 2 notes for musculoskeletal. Under the notes, it does indicate to us to use external causes following the code of a musculoskeletal condition, if applicable, to identify the cause of the condition. So condition versus diseases, keep in mind a condition is something that happens or that they can acquire, whereas a disease is something that is within the body. Excludes 2 indicates a few different conditions that you would be coding. Arthropathic psoriasis, which is a skin condition, certain conditions in the perinatal period for babies, newborns, infectious and parasitic diseases, which should go under infections, traumatic syndrome, compartment syndromes, pregnancies and births, congenital malformations, deformations, and chromosomal abnormalities, all should code to those sections. Endocrine, nutritional, and metabolic diseases, injuries, poisonings in other areas, neoplasms, and symptoms and signs and abnormal findings not elsewhere classified. So everything that we've talked about in some of the videos that I've provided, all of those should be coded to those sections if they apply to those areas. So when you're looking at musculoskeletal, it actually takes out a lot of the muscles and a lot of the skeletal conditions that would apply elsewhere, such as injuries. So our fracture to the left arm, if it was, if Mr. Blue here had it as just an acquired fracture or traumatic because he fell and hurt himself, this would not code to the musculoskeletal, even though it is the bone that's being treated, because that would instead go to injuries. Okay, so we have a few blocks here. We go from infectious arthropathies, autoinflammatory syndromes, inflammatory polyarthropathies. I'm going to stumble over all of these words because I don't say them on a regular basis anymore. Forgive me for that. Osteoarthritis, other joint disorders, dentofacial anomalies, systemic connective tissue disorders, deforming dorsopathies, spondylopathies, other dorsopathies, disorders of the muscles, disorders of synovium and tendons. Yep, those are included. Okay. And let's see, sorry, there's a few more. Disorders of bone density and structure, other osteopathies, chondropathies, other disorders of musculoskeletal and connective tissues, intraoperative and post-procedural complications, periprosthetic fractures, and biomechanical lesions not elsewhere classified. Whew, that's a lot of terminology and a lot of breath just to say all of that. So what does that mean? Well, pay attention to your blocks. Make sure that when you're coding for something, you identify if you're in the right area, and you want to make sure to pay attention to all of the notes and always read up and down. Always start with your block. Look at the block after you've checked the chapter, of course, which we just did. Look at the block that your code falls under. Look at the category, and then build the code, even if the alphabetical has directed you to a direct code. This will help you to identify any additionals, use first, and go somewhere else for excludes notes. So that's all very important. Okay, so just a quick overview of this system. We're not going to go into too much depth, although we will code one in this video, but this video is going to be relatively short. because there's a lot of really great information out there, and the best way to do musculoskeletal coding is, of course, just to get in and start doing it. Things to be aware of, again, paying attention to your terminology. We have a couple of terms here, just to remind you: myopathy, arthropathy, chondropathy, and dorsopathy, spondylopathy. So a lot of pathies means disease of, and then you want to break it up. Where is this disease of? You have muscle, joint, cartilage, back, and vertebrae. And yes, the back and vertebrae is considered different in that sense. So you want to pay attention as you're going through joint and spinal diseases to your terminology and what it is that you're coding for. You will be looking at things like rheumatoid arthritis and osteoarthritis, as well as some of the various different conditions that apply with that. One of the things I can say is pay attention to the difference between what the doctor is saying, what type of arthritis it is. So remember that arthritis is an inflammation of the joint. Rheumatoid arthritis is a condition that also includes the muscles, whereas osteoarthritis also includes the bones. So you want to pay attention to exactly what they're looking for. There's a lot of tests and a lot of lab work that they will send for rheumatoid arthritis. Bone density scans may be done for osteoarthritis, and they may have signs and symptoms or other conditions that can apply, such as osteopenia. We also have some conditions that are familiar with some patients. You have gout, which is a very common condition, especially in older patients or patients with rheumatoid arthritis, spondylitis, and various other disease processes. A lot of these conditions can end up affecting a lot of areas of the body. A patient that has gout, or also known as gouty arthritis, is someone who has issues with their toes. So it ends up having a lot of uric acid and builds up in their toes. It hurts really, really bad. Makes it sometimes where they can't even walk. And so the provider can diagnose them with that. You have osteoarthritis, which is a really nice one. I like coding osteoarthritis because you can look at it and say, do we know which area that the osteoarthritis is? Meaning, is it localized or is it generalized and unspecified? And you want to pay attention to those areas because a lot of times the code that you're selecting does have very specific options. And we're going to code one of those together. Dorsopathies and spondylopathies, these are diseases that affect the joints of the spine. And so when you're looking at the spine, always pay attention to what part of the vertebrae that you're in, because that's going to identify the different areas. So you may want to refresh yourself as you're coding through those. When you're looking at other conditions of the spine, such as spondylitis or scoliosis, pay attention to the terminology. Make sure that you don't get those words mixed up. A lot of these conditions are going to be pulled directly by the name of the condition, so you don't have to think of synonyms all the time of what is this also known as when you're looking in your alphabetical. Okay, and then the last thing I wanted to talk to you, the last two things, soft tissue disorders. One of the most common is fibromyalgia. Now, a lot of patients have fibromyalgia, a lot of individuals that I know personally. This is a condition where an individual just feels constant pain, and they can have flare-ups, things that may trigger it, and it'll be any variety of pain symptoms. So you want to pay attention that you don't code a nervous system condition of pain if they have fibromyalgia, because fibromyalgia is in and of itself a condition of the muscles. We're not really sure what causes it. I've read some studies that talk about blood vessels possibly being a cause for patients who may have larger blood vessels and having fibromyalgia, but there's really not enough out there yet to say exactly what is fibromyalgia, what is the cause. We know it's a real condition, we know that it affects patients, and we know a lot of the effects of how it affects patients. But pay attention to that when you're coding to make sure you are looking at the signs and symptoms as part of the condition, not coded separately. Myositis, polymyositis, let's see, you have a couple of different muscle disorders. And so when you're looking at soft tissue disorders, you're looking at things with the muscle. You're looking at things with the connective tissue, the bursa, the synovial fluid that's found inside the joints. You really want to pay attention that you go beyond the skin. So if it's into the muscle and it's into the fascia, pay attention to how the doctor documents. And if they don't document how deep of something it's going, if they're doing diagnoses of a condition, pay attention to those and question those. Okay, let's see. Outside of that, you have acquired conditions and congenital conditions. And we already mentioned pathological fractures. So for your acquired conditions, these are going to be things that a patient may have had. So they give us an example here. For example, a Duchenne's muscular dystrophy. Let's say that 3 times fast, or DMD. This is considered acquired because it's not congenital. A patient, another example, which falls under some of the spondylitis, but ankylosing spondylitis works very similar, and it's something my dad has, so I can kind of talk a little bit about it. But you have a patient here who has their DNA strand, and in the DNA strand it has all this nice little detail, and somewhere in there they carry a gene that can end up getting converted into a disorder, but it's not necessarily something that they have. So it's kind of like patients who have a gene for breast cancer or a gene for cardiovascular conditions. In this example, they're giving us the DMD, where it's caused by a mutation of the gene within the X chromosome, and it results in the body's inability to create dystrophin proteins within the muscles. At that point, they start to have issues and start contracting, and their muscles start to weaken. They also give another example here of Myasthenia Gravis, chronic autoimmune condition that causes muscle weakness, primarily in the face and neck, due to immune system incorrectly attacking the muscles. So this one has various codes in the G section that you would list for those. And some of these, you will notice, may not always go to the musculoskeletal system, but rather to the nervous system, because a lot of our nerves work with the muscles. You remember you have your little muscle, and intertwined with that is your nerves. And so you want to keep in mind that anything the muscle does, if there's a neurological condition that can affect it, you're going to be looking at both musculoskeletal and neurological. Outside of that, congenital disorders are things that patients are born with. So not necessarily a gene that later is triggered or has a malfunction, but something that when they're born they have this disorder. One of the most common ones is spina bifida, which is where the patient doesn't have a full closed spine, and so they have various issues as they're growing as young children. A lot of times those are corrected throughout their young life, and so we'll see them over and over again for various check-ins on that. So that's kind of the general consensus within the book. Really, what you want to pay attention to in the musculoskeletal is there's a lot of diseases and disorders that can affect the patient, and become familiar with what those are. If you're not familiar with it, remember that Google is your friend. Never marry her, because she can give you some guidelines and some guidance as to where to start looking. She can give you definitions, but she's definitely not trustworthy. So you want to always verify your coding in your tabular. Always look up your terminology in a reputable medical dictionary if you have one, but use Google as a guideline if you need it. Pay attention to what she brings you, though, because you want to be wary of advice on coding that takes you in areas to say this is appropriate or not appropriate from companies that are looking to make money or are not really related to coding. Anybody can get on the internet and start a blog, so keep that in mind. All right, so let's do one of our coding examples. Before we're done here, I'm going to turn in my coding chapter, or I'm sorry, in my textbook chapter, Let's Code It, to the musculoskeletal section, chapter 15. And I mentioned to you earlier, I want to code some osteoarthritis. So the patient here, okay. I know I wanted to code some osteoarthritis, so we're going to keep looking till we find one. Okay, I guess we're going to code a different one. Let's code some gout. Okay, so our patient here, we're going to do a different scenario. We have Timothy Mitrosky, who is a 55-year-old male, comes to see Dr. Winegard with complaints of acute pain in his left hip. Okay, so we'll take Mr. Blue off the board here. We still have a patient that's unhappy. This time it's acute pain in his left hip. Okay? He had been diagnosed with stage 1 chronic kidney disease about 1 year ago, but it has been under control with medication. Dr. Winegard aspirated synovial fluid from his hip, and the pathology report confirmed that Timothy had developed secondary gout in his hip. Okay, so a couple of things. We have a patient with chronic kidney disease, type 1. We have secondary gout. And they mentioned that it was confirmed. So that means that a pathology report was done. They sent the synovial fluid to the laboratory, and we can code, if that comes in before our code goes out, and it's confirmed and reviewed by our doctor, we should list that instead of pain of the left hip. So keep that in mind. If you have a pathology report with a confirmed diagnosis, to include that. It's also important to take note of where it was at. So in the synovial fluid of the hip joint. I always try to remind patients that when you're talking about hips, elbows, knees, ankles, and wrists, you're talking about joints, because when you're looking up your terminology, one of the things to keep in mind is anytime you have to look up coding for a joint, to start with the terminology that it is in the joint. So we have a couple of things that we're going to code. First is going to be the chronic kidney disease, type 1, and then the secondary, if I can spell here, secondary gout. Let's see, of the left hip. Okay. Now, the reason we're going to list this in this order is because we have a primary condition confirmed, which is the chronic kidney disease. So we haven't really talked about this. This falls under a different area. I'm just going to let you know, with chronic kidney disease, there are a lot of rules and guidelines, but the biggest thing to keep in mind is to pay attention to your guidelines when you're looking at the urinary chapter. I'm going to start with looking up chronic kidney disease just because I know that this is the condition. And I'm just going to look for the term chronic kidney disease. And so you can code along with me. I always like to take my time here. I don't like to take my time, I just do. And so one of the things you're going to find when you start looking for certain conditions, such as chronic kidney disease, is that anytime you look up for the term chronic, and I'm going to tell you where that's found on page 90, it's going to tell you to see the condition. So if I'm looking for the word chronic, I have to say, okay, well, what's the condition? It's kidney disease or disease of the kidney. And so in this case, you may find it, you may want to go ahead and go under disease because you're going to find it easier that way. Some books may have additional information in your alphabetical where they would have it under kidney, but it's not common. So your action word, your main term for CKD is disease. That is the problem. Chronic is describing the type of problem. Kidney is describing where. Okay, so you're going to find disease of the kidney, which will be found on page 136. And I find that in the third column, about halfway down, chronic, stage 1, M00-M99. Okay? So I'm going to list that. I'm going to look up that code, and because this is a new area, coders should take their time to review all of the information for kidney concerns. So there's not a whole lot. It starts on page 863 for diseases of the genital, urinary, and male reproductive. There's a little bit of anatomy and common pathologies listed. There are some excludes notes, and if I read through these rather quickly, I can see that none of them will apply to Mr. Mitrosky. Okay, so I'm going to continue going. I'll notice that N18 falls under the block of N17 through N19, and so I'm going to look for that, which I will find on the bottom of page 869. Acute kidney failures and chronic kidney diseases. There are excludes for congenital renal failures, drugs, and then a few symptoms. Nothing from what I'm reading through here that affects Mr. Mitrosky. So I'm going to keep going, and I'm going to keep in mind that N18 was the code. And N17 is acute kidney versus chronic kidney. And here I do have a code first note. Okay, so this is very important. Code first any associated diabetic chronic kidney conditions, hypertensive chronic conditions. Okay, so my code first, is this a diabetic or hypertensive condition? No, so that's still going to be listed as secondary. It says use additional code to identify kidney transplant status if applicable. No, they didn't mention that. So then pretty straightforward, N18.1 is my code for chronic kidney disease type 1 or stage 1. So now I'm ready to look at the actual condition that the patient is being seen for, which is gout or gouty hip due to the chronic kidney disease. So I'm going to go back to my alphabetical, and I'm going to look for the word gout, because this by itself is a problem or a condition. I'll find gout on the bottom of 189, and I have a generic gout or gouty, such as acute attack flare, see also gout chronic, M10.9, but this was specified as to the type, so I'm going to keep going. I have drug-induced gout, which this is not. I have idiopathic in specific locations, so there is, for example, in renal impairment, in or due to renal impairment and specified locations. That to me says, okay, that's your code. This is a renal condition. Remember, the terminology for renal is kidney. And so in a renal condition, yes, absolutely, in or due to renal impairment of the hip, M10.35. Okay, so I'm going to mark that down. I notice there's a little check mark, which means there's an additional character required with this code. So that's not a complete code. I will have to verify it, which I would anyways in my tabular. So now I'm going to go to my musculoskeletal section to find gout for M10. But before I look at category M10, again, I look at my chapter. I've already looked at it, so I already know that none of the excludes notes apply, but I want to identify the block for M10. By looking at that, I find that the block for M10 falls under inflammatory polyneuropathies, M05 through M14. Stop there and ask yourself, is this a inflammatory polyarthropathy? Disease of multiple joints with inflammation? Yes, it is, because gout is considered to affect multiple areas, or it can. This one just presented in the hip today. So I'm going to continue going, and I'm going to say, okay, that block starts with M05, which I will find on page 779. For the block 779, inflammatory polyarthropathies, M05 through M14, there's no notes or excludes notes, so I can continue going to M10. And because I did have a direct terminology that gave me to this code, I'm pretty confident that M10 is going to be the correct category, and I'm going to go ahead and flip over to that now. I'm going to find M10 on the top of page 789 in the second column. And here, the term for gout is listed as the entire category for M10. So I know that that is correct because this is gout. It gives me examples of acute gout, gout attack, gout flare, podagra, and it has use additional notes in my coding. Use additional notes to identify autonomic neuropathy diseases, calculus of urinary tract diseases, cardiomyopathies, disorders of external ears, disorders of iris and ciliary body, and glomerular disorders. So these are all conditions that a patient can get as a result of gout. None of these were documented for Mr. Mitrowski, so I'm going to continue going. Our first category, fourth digit, is idiopathic gout, which this is not. We have lead-induced gout, which this also is not. Drug-induced. Due to renal impairment, yes. So M10.3, which we already knew, is correct. Code first, associated renal disease. So I've already listed this first, but that code first means that that is my primary diagnosis for this type of condition. And it's very important that you pay attention to that. Okay? So code first renal disease, which I've done. And then I have the differences for my fifth character of gout due to renal impairment of an unspecified site, shoulder, right, left, elbow, right, left, wrist, hand, hip, I finally have. So M10.35, which is in fact the code we had originally. Now the difference with M10.35, you'll see has a 6-digit requirement, and that's what that little check mark was. And we have 3 options. I have M10.351 of the right hip, 352 of the left hip, or 359 of an unspecified hip. So this again falls down to where the provider needs to make sure they've documented the location of the condition that they're treating, and if it doesn't, we might query, or we could code unspecified, which would not likely get paid. In this case, we know that it's of the left hip, and we can verify that in our documentation just in case that it was in fact his left hip he had pain in. And so even though the diagnosis said secondary gout of his hip and did not specify, the initial HPI or present history of the present illness, the condition he came in with was acute pain in the left hip. So we can verify it because it was documented there that it would be at the left, and our code would be M10.352. So I'm going to take out this check mark here and replace it with a 2. And at this point, I know that's the correct code. I can verify in my textbook, and in fact, it has all the steps that we just did. So, fairly straightforward with musculoskeletal coding. Things to pay attention to and terminology to really be aware of are your big key points when coding out of musculoskeletal and connective tissues for M00 through M99. That's all I have for this video. Until next time, have a wonderful week.